And this was a large and a very heavy fruit. Yeah, very poisonous. So I also discovered a suicide tree along coastline in Thailand, Pattaya Beach, and also growing preferentially in coastal salt swamps areas. It is a very water-loving plant. This one, please. Oh, and at high tide, its roots are submerged in seawater. So you can see that it is planted very close to the sea, right? Very close. And this is a white latex from the petiole of the suicide tree. Similarly, you can observe the latex in a cross section of the leaf and the fruit. So poisonous compounds such as cardiac glycoside are reportedly present in this white latex. As one should avoid touching the latex with bare hands or unprotected hands, but I touched the plant with most care because I didn't have the growth at this time. Okay. And when I visited the USM University, Saints, Malaysia, so in Penang last year, I found this plant on the campus, on the campus of USM. So, but I don't know why the plant is growing on university campus. Yeah, it's scary. So you can see there's just green fruit growing on it. Yeah. Yeah. Okay. And this green fruit gradually decays and eventually becomes dry like this. Okay, you can see the dried fruits represented within the red circles. These dried fruits are sold as ornaments on the internet, like this. So, okay. On cutting the dried fruits, I extracted the kernel from inside, and this kernel was about 2 centimeters wide and soft like ganache chocolate. So this kernel contains many poisonous cardiac glycosides. So this is the chemical structure of suberin, one of the cardiac glycosides present. And cardiac glycosides are composed of three parts: the lactone part, and the steroid part, and the sugar part. The suberin is the main toxic compound in the suicide tree. Therefore, this kernel has been used to commit suicide. Okay, can you guess which of these is the poisonous tree? Maybe you can. So these were plants growing nearby, and most Japanese cannot distinguish between them. Okay. Yes. Uh, if you choose this one, you would die. Yeah, several of them. This is the poisonous. Yeah, this one would make you happy, right? So maybe you know mango. Yes, this is a mango. I didn't distinguish these two. Okay, and the name Sabera is derived from Saberas in Greek mythology. So Cerberus is known as the Hound of Hades, as depicted in this picture as a three-headed dog. This one, right? So some of the audience may already know this creature as it appeared in the movie Harry Potter, right? Harry Potter. The Hades is the older brother of Zeus, Almighty God, and the king of the underworld. The Cerberus is kept by Hades and guards the gate of hell. The tree has been so named since the toxic compounds are distributed through the whole tree. And this is a painting by Peter Paul Rubens. This is Hercules, a demigod, and this is Cerberus. According to mythology, during a struggle with Hercules, saliva from Cerberus dropped to the ground, sprouting a poisonous plant. This is a famous plant, aconite. Yeah. Now you understand the dangerous nature of cyber organ. It's very dangerous plant. So in the past, this tree was used in the practice of trial by ordeal in Madagascar. Trial by ordeal was a practice in which a person's innocence was tested by putting them in a dangerous position and having them perform a difficult test, including swallowing poison. For example, after eating these seeds, death implied guilt, and survival signified innocence. So between 1828 to 1861, it has been said that this poison ordeal resulted in about 3,000 deaths annually. Eventually, trial by ordeal was abolished in 1863. Okay, in 2004, Guy Yard authored a paper presenting the suicide tree. So in this study, the authors reported the number of deaths involving the suicide tree in the Indian state of Kerala. Here, Kerala. And this plant reportedly caused a total of 5,537 deaths in Kerala, only Kerala. However, this is probably an underestimated value since reliable analytical techniques were not exist at this time. The number of deaths could be double or even more than reported. So incidentally, are you aware of this plant? This plant? Hebetua pelviana? Yeah, this plant is also poisonous, containing same poison component, cardiac glycosides, that used to also commit suicide. Okay, furthermore, the authors stated that these plants are relatively unknown to Western physicians, chemists, analysts, and even coroners and forensic toxicologists. Japan faces a similar situation. So hence, homicide mediated using these plants may be overlooked. Okay, now revisiting our case. So the patient purchased the dried fruits of the suicide tree through a web-based online shop. So I tried to see if I could actually buy it from an internet shop. And this is the parcel that arrived from Thailand. Yeah, so I found that anyone can easily purchase it at a cheap price. Easy to get. So the parcel contain 10 dried fruits, but even one or two kernels would enough to die. So as seen in this picture, each fruit was about 6 to 9 centimeter in diameter and sphere-like in shape. Very cute, right? And in Malaysia, you can also buy just 3 ringgit, but sold out. Okay, and back to the case. So this picture is an endoscopic image of the upper gastrointestinal tract. So an obstacle can be seen here, and this picture displays extracted gastric contents. As stated by the patient, 2 kernels were probably ingested. So next, I pre-treated part of gastric contents according to the procedure related. The gastric contents were dried and ground, extracted using ethanol, and evaporated to dry. The residue was diluted using ethanol and analyzed by LCQ of MS. So carotenoids such as saberiginin, diacetyltangenin, tangenin, nerifurin, and saberin were detected in the gastric contents. So hence it could be concluded that the patient ingested the suicide tree kernel. So next, the serum and the urine of the patient were processed as described in this procedure. It's very simple procedure. Notably, only deacetyltangenin and nerifurin were detected in the both urine and blood samples. So this indicated that the saberin and tangenin, which have an acetyl group in the structure, were rapidly deacetylated in vivo. So like this. But anyway, in this case, detection of these cardiac glycosides in biological samples provided proof of ingestion of the suicide tree kernel and died. This is my level. As commerce becomes more globalized, it is likely that there will be an increase in death cases caused by plants that are not native to the area. So further caution is required. This is my favorite plant. Okay. And next case, I will introduce the aconitum poisoning case. Aconitum grows wild in Japan, and there have been many poisoning cases. Malaysia also native to this plant, right? No, no. So oh, really? And in Japan, aconite, this one, and the water hemlock. A scientific name is Cicuta villosa, and Doku Utsugi. A scientific name is Polyallia japonica. Considered the 3 most poisonous plants in Japan. In these 3 plants, the most common is aconite, this one, with accidental ingestion causing poisoning every year. And it is also sometimes used in murder and suicide. So in recent years, cases of poisoning and deaths due to this Cicuta villosa and Corelia japonica have become rare, with more deaths due to Horchicum autumnale and gloriosa. So aconite often described in many suspense novels, anime, and manga like Detective Conan and Golden Kamuy and the Apothecary Diaries, So I'm sure you've heard of it at least once. This, no? Yes. Yes. And there are approximately 300 species of Aconita that grow natively in many countries in Northern Hemisphere, including North America, Europe, and Asia. Aconite produces beautiful flowers in early autumn, like this, very beautiful. When the flowers are in bloom, like these pictures, it is not easy to mistake aconite for other plants, so there is almost no risk of accidents in this season. But what about this? One is a poisonous aconite, the other is an edible plant. Almost same, right? So in Japan, people every year after mistakenly eating aconite during the budding season. So in fact, I find it very difficult to tell the difference between the two plants growing in the wild. This is a content. What's that? Edible. Okay. Aconite contains aconite alkaloids, so which have complex structures shown in this slide. This one. Among these, aconitin, mesaconitin, Poconitin and Jesaconitin, which are circled in lead squares, particularly highly toxic. Average dose lowest LDLO is described in 2 to 6 milligram. Very toxic. And as shown in this slide, there are several drugs and toxins that act on sodium channel. And currently, 9 forms of voltage-gated sodium channels are known, and they are expressed in tissue such as the central nervous system, skeletal muscles, and the cardiac muscle. So aconitins reversibly bind to site 2 here of the sodium channel, and increasing the sodium permeability of the sodium channel and blocking the inactivation of the sodium channel. As a result, various symptoms of poisoning occur, including arrhythmia and numbness or paralysis in the limbs. And as their pharmacological action, aconitins reversibly bind to site 2 of the sodium channel alpha subunit, and their action is concentration dependent. On the other hand, sodium channel blockers such as lidocaine bind to a site that is different from the site where aconitin binds. So in other words, sodium channel blockers exert their effects through an allosteric action rather than through competitive antagonism with aconitins at the receptor. Okay, symptoms in the study patients with aconite poisoning were arrhythmias in 26 cases, nausea or vomiting in 24 cases, and saccumoral paresthesia in 23 cases, numbness of the extremity in 23 cases, palpitations in 19 cases, hypertension in 18 cases, chest pain or chest discomfort in 17 cases, consciousness disorder in 13 cases. Okay. Regarding the onset of symptoms, neurological symptoms such as saccumoral paresthesia appeared fast. And many deaths from aconite poisoning are due to cardiac arrest caused by arrhythmias. So therefore, arrhythmias caused by aconite poisoning is recognized as a life-threatening poisoning symptom. Okay, as shown in this figure, arrhythmias observed in patients with aconite poisoning were diverse. So with premature ventricular contractions, PVC, being the most common, occurring in 17 of 26 cases. And ventricular fibrillation was observed in 7 of 26 cases. And the VF caused by aconite poisoning, difficult to treat because it is resistant to antiarrhythmic drugs and defibrillation. Okay, this is a case that I experienced in the past. Would you please read case history? Okay, so the patient died mysteriously in a hospital. So the body was autopsied and the blood and the stomach contents were collected for identifying cause of death. So this slide shows electrocardiogram ECG of the patient during treatment. So it is obvious to anyone that this is an abnormal ECG, right? Yeah, this is normal adult ECG, right? Difference. And normal ECG is regular and cyclical like this slide. Totally different, right? Okay, based on the clinical report and this ECG, of course, aconite poisoning was highly suspected. So therefore, toxicological analysis of aconitins was performed in this case. Okay, this is a result of ACMS analysis obtained in the case described. Aconitins and their hydrolysis products are detected in both blood and gastric contents. And the concentrations were equal to or greater than those reported in previous fetal cases. Therefore, we concluded that the cause of death was aconite poisoning. But how could the hospitalized patient have access to aconitum? Mysterious. Maybe family members or acquaintances may have been involved in this case. But identifying the culprit is out of my work now, so I'm not sure what happened after that. And the mystery has yet to be solved. Okay, for case two, I will talk about a murder case happened in Japan in which algorithm was cleverly used. So this is the case history. A woman and her husband arrived in Naha Airport, the capital city of Okinawa Prefecture. Her three female friends joined her at Naha Airport and took plane to Ishigaki Island. However, her husband canceled his trip at the last minute, stating urgent business, and stayed back at Naha Airport. After checking into the hotel, woman suddenly began to experience discomfort and was transported to the emergency department, but died. At the autopsy, no specific findings were detected. The husband had been previously married 3 times, and 2 ex-wives had died in a similar manner. Okay. The toxicological analysis revealed that the biological samples of the deceased contained aconitum alkaloid. However, police were unable to arrest her husband because there was a relatively long lag time between the point when the victim left her husband to meet her friends and her death. So this had to consider in the context of the known mechanisms of aconitin toxicity. So police could not arrest him because of his scientifically convincing alibi, even though aconitin alkaloids detected from her biological samples. The husband's claim was the symptoms should appear soon after taking aconite, but my wife died more than 1.5 after her last contact with me. So therefore, I'm not the culprit, he said. So what trick do you think the husband employed to secure his alibi? He definitely used aconite as the poison. Okay. He also simultaneously used pufferfish toxin, named tetrodotoxin, TTX. So aconite is toxic by opening sodium channel. In contrast, tetrodotoxin closes sodium channels. The action of two poisons were suppressed by the non-competitive antagonistic action. Eventually, when tetrodotoxin decomposed, the toxic effect of aconite emerged. So her husband had adjusted the onset time of poisoning by using two different types of poisons. That was historic. Okay, as mentioned before, aconitins binds uh, receptor site 2 and opens sodium channel, whereas heterotoxin binds to receptor site 1 and closes sodium channels. So by using two kinds of poison that targeted the same sodium channels, but different receptor site, he had adjusted onset time of poisoning. Okay, in fact, her husband had performed repeated animal experiments using mice to determine the best ratio of aconitin and tetrodotoxin dose for extending time of death. So in this paper, so when the dose of aconitin was fixed to milligram and the dose of tetrodotoxin was varied from 0 to 1 milligram, it was shown that the time of death was extended. In addition, when the dose of aconitin was fixed at 3 milligram and dose of tetrodotoxin was varied from 0 to 1 milligram, it was shown that the time of death was prolonged differently. So it was confirmed in mice experiments that the time of death can be controlled by varying the dose of aconitin and the tetrodotoxin. Okay, so today I gave a talk about only two poisonous plants. Since I'm a forensic scientist, my research interests focus on basically the dark side of plants. Of course, as a bright side, many plants contribute greatly to humans' lives as medicines, foods, drinks, spices, and so on. However, plants are essentially just there, and there is no distinction between toxic and non-toxic. It is simply for human convenience that plants are classified as medicine if they have a beneficial effect on humans and as poison if they have an undesirable effect. So this is a portrait of Paracelsus, alchemist. He left us the classic toxicology maxim, sola dosis facit venom, with Latin, which means dose makes the poison. So whether the plant is poisonous or not simply depends on the amount ingested. So in fact, poisonous plants can be used as medicines in the correct doses, and the medicinal plants can also become poisonous if used in the wrong doses. So in other words, whether a plant is poisonous or medicinal just depends on how humans use it. So let's use them correctly. Okay, that's all from me. Thank you for your attention.
All right, so thank you so much, Dr. Kiyotaka, for such interesting talk. I believe all of us learned something new. So now we open any question from the audience on joining us online and also from any audience joining us physically. Yep. So if the participant joining us online, you can just put in your questions in the chat box and we will read it out, or you can unmute yourself.
So, um, for the ones that they then do suicide and whatnot, you think they just took the blood itself, or is there an extracted version?
It depends.
Yeah.
It depends. It depends.
So,
So someone extracted the poisonous ingredients. Yeah.
and how do you for work-wise, how do you extract it?
Sorry?
How do you extract it for your research?
In my case,
In your research?
to detect the poisonous from blood.
Do you extract the compound from the blood, or
What? My work?
your research? Do you extract the poisonous toxin?
Yeah. Yeah, I usually extract using organic solvent. Yes.
So let's say if you are, let's say theoretically, if you're taking the blood, how many do you have to take?
That's blood.
Yeah,
So 1 or 2 kernel is enough to die.
1 or 2,
Yeah.
1 or 2 grams of that.
No, no, kernel. In the society, 1 kernel is enough to die. So one seed is enough.
The
Yeah, but I both and seeds.
there were other metabolites that you showed earlier. Does that also contribute
Yes,
to
exactly.
the death?
Exactly.
And they are also sodium channel opener, or do they act differently?
So suicide 3, it does different action than so suicide 3. They have cardiac glucoside, right? So they bind to
Potassium, the potassium.
so sodium potassium. Yes, yes. So what was again? What was your question again?
Yeah, the other mechanism apart from sodium channel opener. There are other mechanisms that I saw. There's acetylcholine is one of it, but there were three more metabolites that I can see.
Huh?
This one,
Ah,
next, yeah, the metformin and hypercontin. Does that also contribute to
yes. So yes, yes, yes.
the toxicity as well?
Yes. So
And the
very
mechanism also sodium
same.
channel
Yes.
opener.
Yes. So almost the same LOD 50. LD 50.
And the also.
Yes.
Doctor, if I may ask, for example, you see just now that in Malaysia, you can actually find these like three in USM and NS protein in the fish. So maybe you can share with us one of the tips for us to ensure that the plant is safe, because some of them they look really similar between poisonous and edible. So maybe because some of us might go to the forest and we just cook and eat it. So we don't know. So is there anything that we can do? Maybe we, some people say we eat and we just rub it on our skin and we feel some thing. Is it true?
Agak
How do we know that the plant is edible and the plant is not poisonous? Because some of them it looks really similar,
yeah.
right? Yeah.
So that means
I'm not sure. You have to run. Check in the appearance.
Okay. 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 All right.
Just a question. So, based on your experience, so because these are part of suicide, so we want suicide. The people intend to die, so they eat on purpose to die. So, have you ever encountered any accidental poisonous?
Yeah, of course. Yes.
So, what was the management to handle such cases?
What do you mean manage the
Patients,
patients
how to manage the patient for that type of case?
for
Pong pong, for example.
ah? So basically, I'm not physician. I don't know how to treat, but most of the case, uh, yeah, patient die. So it's difficult to say.
kita ada already.
And doctor, we have one question online. So from Anik Zaini, what psychological techniques are used and what are samples to send to detect plant toxins during postmortem? So what are the techniques and the samples? Maybe during autopsy.
Okay. So basically, we use mass spectrometry techniques like LC-MS-MS and QTOF-MS-MS. I guess QTOF-MS-MS is the best. Uh, that this instrument has high sensitivity and high resolution. So I recommend use LCM, QTOF-MS-MS. And we also use GCMS also. Yeah, but it depends on the compounds. And for example, yeah, basically blood sample, especially in postmortem cases, usually we use whole blood because the from dead body we cannot get the serum or plasma. It's difficult. So basically, we use whole blood and also urine and tissue sample like a liver. Yeah.
Okay. So about the economic case and the technology. So I saw the paper published around the 3 million kilogram like 1 month. Like, so I'm just calculating if the wife was 70 kilograms. So the husband must have
Yeah. Yeah. So this the calculate both many papa fish from fish market and extract it, and also the agonitam. He get many agonitam and extract it. He's almost a scientist.
Yeah.
but the husband need to publish the paper, right?
No.
This one
No.
It's nice.
It's a nice experiment.
But he got access to a lot. Surprise.
Maybe any more questions from people joining us online or from this room? Any question? No? No? Okay. Alright, so if that's the case, again, thank you so much.
Arigatou gozaimasu.
Yeah, I believe our president, many things today, and next I would like to invite. Okay, alright. So thank you so much for doing this online and because we have a crowded talk coming this year and also next year. Thank you so much and have a nice day, everyone. Thank you. Okay, so for the joining us online, you can click access the attendance link provided in the chat box for attendance. Kita ada
Arigato.